Amlodipine belongs to a class of drugs called calcium channel blockers. It is a widely prescribed medication known for its effectiveness in managing hypertension and other cardiovascular conditions such as angina and coronary artery disease. In this video, we will explore the uses, mechanism of action, dosage, and potential side effects of amlodipine, as well as its interactions with other medications. Amlodipine is also known by other brand names such as Catersia, Norlicva, and Norvasc. Primarily, amlodipine is prescribed for the treatment of hypertension, a prevalent cardiovascular condition characterized by elevated blood pressure levels. By blocking calcium channels in vascular smooth muscle cells, amlodipine induces vasodilation, leading to a reduction in peripheral resistance and blood pressure. This helps in preventing complications associated with long-term hypertension, such as stroke, heart attack, and kidney problems. Amlodipine is also indicated for the management of chronic stable angina, a type of chest pain that occurs due to reduced blood flow to the heart muscle. The vasodilatory effects of amlodipine contribute to increased blood supply to the heart, relieving the chest pain associated with angina. It is often prescribed as a monotherapy or in combination with other anti-anginal medications. In cases of vasospastic angina, where coronary artery spasm leads to reduced blood flow to the heart, amlodipine proves beneficial. The vasodilation induced by the medication helps alleviate coronary artery spasms, improving blood flow to the heart muscle, and relieving the symptoms associated with this form of angina. Amlodipine, a calcium channel blocker, operates by selectively inhibiting L-type calcium channels in vascular smooth muscle and cardiac cells. This inhibition results in vasodilation of peripheral arteries, reducing systemic vascular resistance and lowering blood pressure. Simultaneously, amlodipine decreases the contractility of the heart muscle, lessening the workload on the heart. This dual action makes it an effective treatment for hypertension and angina. Amlodipine can cause dizziness, especially when standing up quickly. Patients are advised to rise slowly from a sitting or lying position to minimize this effect. Swelling of the ankles or feet, known as peripheral edema, is a common side effect. This occurs due to the vasodilatory effects of amlodipine, leading to fluid retention in the extremity. Some individuals may experience flushing, a warm sensation or redness of the skin. This is generally mild and transient but should be reported if persistent or severe. Headaches are among the common side effects of amlodipine. While often mild, persistent or severe headaches should be communicated to healthcare providers. Amlodipine may cause mild fatigue in some individuals. This side effect usually diminishes with continued use, but any excessive or persistent fatigue should be reported. Amlodipine's vasodilatory effects may lead to a drop in blood pressure. Severe hypotension can result in dizziness, fainting, or even shock. Regular blood pressure monitoring is crucial, especially during the initial stages of treatment. In rare cases, amlodipine may cause an increased heart rate. Individuals experiencing palpitations, rapid heartbeats, or any unusual cardiac symptoms should seek prompt medical attention. In individuals with pre-existing heart failure, amlodipine might lead to worsening symptoms. It is crucial for such patients to be closely monitored by healthcare professionals. Amlodipine is metabolized in the liver, and while severe liver issues are rare, they should be monitored. Persistent nausea, yellowing of the eyes or skin, or abdominal pain warrant prompt medical evaluation. Though uncommon, allergic reactions to amlodipine can occur. Symptoms may include rash, itching, swelling, severe dizziness, or difficulty breathing. Immediate medical attention is essential if any signs of an allergic reaction manifest. The dosage of amlodipine is individualized based on the patient's medical condition, response to treatment, and the presence of any comorbidities. The typical starting dose for the management of hypertension is 5 mg orally once daily. Depending on the individual's response, the dosage may be titrated upwards to 10 mg orally once daily. Elderly patients or those with hepatic impairment may start with a lower dose to minimize the risk of adverse effects. Amlodipine is often initiated at 5 mg orally once daily for the treatment of angina. If necessary, the dosage may be increased to 10 mg orally once daily based on the patient's clinical response. The severity of anginal symptoms and the patient's tolerance to the medication influence dosage adjustments. Due to potential age-related changes in drug metabolism, geriatric patients may start with a lower initial dose. Close monitoring is essential to assess the need for dose adjustments. No dose adjustment required in renal impairment. Amlodipine is administered orally and can be taken with or without food. Patients are advised to take the medication at the same time each day to maintain consistent drug levels in the bloodstream. If a dose is missed, patients should take it as soon as they remember. However, if it is almost time for the next scheduled dose, the missed dose should be skipped to avoid double dosing. In the event of an overdose, characterized by symptoms such as severe dizziness or fainting, immediate medical attention is necessary. Regular monitoring of blood pressure is crucial to evaluate the effectiveness of amlodipine and determine the need for dosage adjustments. Amlodipine can interact with various medications, potentially affecting their efficacy or leading to adverse effects. Understanding these interactions is crucial for healthcare providers to optimize treatment outcomes and minimize risks. Combining amlodipine with other antihypertensive medications, such as beta blockers, angiotensin-converting enzyme inhibitors, or diuretics, may lead to additive blood pressure-lowering effects. Close monitoring is essential to prevent excessive hypotension. Medications that inhibit the cytochrome P453A4 enzyme, such as certain antifungal agents like ketoconazole, or macrolide antibiotics like erythromycin, can increase amlodipine levels. Dose adjustments may be necessary to avoid potential toxicity. Drugs that induce CYP3A4, like rifampin, may reduce amlodipine concentrations, potentially compromising its effectiveness. Monitoring blood pressure and adjusting amlodipine dosage may be required. Concurrent use of amlodipine with statins like simvastatin or atorvastatin may increase the risk of myopathy or muscle damage. Dose adjustments or alternative statin choices might be considered. Amlodipine may increase cyclosporine levels, heightening the risk of nephrotoxicity. Close monitoring of renal function and adjusting cyclosporine dosage may be necessary. Concomitant use of amlodipine with phosphodiesterase 5 inhibitors like sildenafil or tadalafil may result in enhanced hypotensive effects. Caution is advised, and dosage adjustments may be required. Combining amlodipine with alpha blockers may increase the risk of orthostatic hypotension. Monitoring blood pressure and adjusting dosages may be necessary. Amlodipine may increase lithium levels, leading to potential lithium toxicity. Monitoring lithium levels and adjusting the dosage may be necessary. Patients should inform their healthcare providers about all medications, including over-the-counter drugs, supplements, and herbal products, to enable thorough assessment and appropriate management of potential interactions. Healthcare providers can adjust dosages, monitor for side effects, or recommend alternative treatments to ensure the safe and effective use of amlodipine in conjunction with other medications. Thank you for watching. Until next time.